Hey, it's Dr. Thornell from New England Family Chiropractic, and I want to talk to you today. I'm going to start this conversation with a kid's toy that you might remember. This was a maze game that you played as a little kid, and the marble over here, the idea was to move the marble through the maze by moving the board, and the marble would roll through the maze, but you had to be careful not to fall into the little holes as you worked your way through the maze. Now, the reason I introduced this picture to you today and talk about that game is that I want to discuss vertigo and how it occurs and how we're able to help certain number of people that have vertigo if they have the right type of vertigo. What we're talking about is a type of vertigo that's called benign paroxysmal positional vertigo. These are the people that in the middle of the night they roll onto their right side and all of a sudden their world starts spinning. They might be sitting on a couch and they lay their head down, and all of a sudden when they lay their head down, woof, the world starts going. They might get nauseous, but it has to do with the position of their head and something that's happening in their inner ear. The way your inner ear works is absolutely amazing, but unfortunately it can go wrong. What happens inside the inner ear is we have what are called hair cells. So I'm going to magnify your inner ear, and we've got these hairs that when I stand up straight, those hair cells fall to the bottom of my ear canal, and they tell my brain that we're standing upright. When I lay on my right side, those hair cells fall and they touch the wall over on the right side, and they tell my brain I'm laying on my right side. Well, what can happen is there are little calcium crystals along these hair cells that can fall off of there over time or with trauma. And that calcium crystal can form a big enough crystal at the bottom that it registers that I'm standing upright, yet I'm laying on my right side, and the hair cells are telling my brain I'm on my right side, and the crystals are telling my brain I'm upright, and my brain can't make sense of that information, and so my world starts to spin. So what the treatment that we utilize for this benign positional vertigo is we actually will take the patient and we have them move through a series of maneuvers that are tested and shown to be about 75% effective, that actually take that little calcium crystal and move it through this labyrinth that's made up in the inner ear, and actually move that crystal out of the ear. And once that happens, the person is no longer dizzy, and frequently it's a permanent cure. The reason it may happen again is as those crystals on the hair cells continue to fall off with age, you may develop it again. But if it's done properly and it's effective for that person, it may be a complete cure for somebody you know who has vertigo. So very interesting way that the inner ear is designed, and it's a very interesting problem. The interesting thing is a lot of people don't know that there might be a permanent resolution to that. So for those people that fit the positional vertigo description, it's about 75% effective, that it's a complete fix, and it happens within a matter of 15 to 30 minutes. So if you know somebody who has vertigo, let them see this video, help them to understand why it happens, and then have them call our office, and we can go through the procedure with them and see if we can help them permanently get rid of their dizziness and the fact that their world spins when they turn on their side.